Hello, my name's Emma Holly. In this little video I'm going to be showing a demonstration of working with the DEEP oscillation device. This is a fantastic device for working with scar tissue and helping promote surgery recovery. Amongst other symptoms, that's not the only thing it's used for, but as a scar therapy education specialist, that's what I'm here to talk about in this video. You'll watch me working with my client who's had nephrectomy surgery 7 months ago, and I'll be talking through how I use the device and the settings that I've got for the treatment today. So I'm just going to do a little demonstration of the DEEP oscillation, nephrectomy surgery. I've got it on an individual setting on the device, so I've got, I'm going to start off with 150 to 180 hertz on a 1 to 2 and see how the tissue responds to that. I've done a little bit of hands-on to warm up because I really like to come in and go hands-on first. How's that feel? Is that okay?
Yeah.
So I'm starting it off at 90%. We've done a treatment with this before, although not for a little while. I've got a little electrode on me. The client has got a little electrode, a little sort of dumbbell, which I've put in his feet, which means that between us we're making a circuit. Just normal non-latex gloves that I'm wearing, and then just coming off and just doing some really light massage. This isn't about applying deep pressure onto the scar. The DEEP oscillation itself goes up to 8 centimetres, has been measured going up to 8 centimetres into the body. So it's not about the therapist having to push hard. It feels more focused if you have smaller contact, just with a couple of digits, or you could be more dispersed. Do you have a preference? Does one feel nicer or the other?
They both feel really nice.
They both feel really nice. How might you describe the sensation for you?
There's obviously tingling. A very slight vibration, but it's tingling. It's not very eloquent, is it? I'm afraid.
That's okay. Stimulating, soothing, intense, gentle?
Not intense. No, I find it quite gentle and it's kind of stimulating and soothing at the same time, which is very contradictory, but it's very pleasant and it's not ticklish, which is what I was thinking it was going to be. It's not intense. No, definitely not intense.
So, on assessment, we had some thickening underneath this middle scar here. The scars are 7 months old, and we got definitely quite a bit of sticking occurring on this lower scar, and it's particularly obvious when Andy's stood up. And so while I'm using the DEEP oscillation, I do still want to be moving this a little bit. My intention, hopefully, just to get under there a little bit too. So I can just do some little rotations on the tissue, just to kind of really send some of that, send some of the treatment, because it comes out in a kind of wave, so that it really hits under there and come in different directions, because it kind of penetrates out like a wave would do on like ripples on water. So I'm interested when I move my hands in different directions, which one feels like it's hitting more, kind of like that the skin's gathering, that the skin's wanting to stop, and which direction. So for me, this comes really with ease. It's smooth. I don't hit as many kind of ridges through the tissue, whereas when I come in this direction, there's a little bit more that I'm hitting resistance, that the skin's less happy to go there. So I'm going to want to vary it, and you can see that if I come across here, that gathers a little bit, less so if I come down over towards the iliac crest. So I'm just going to vary that movement, just giving the skin a little bit of a nudge while it's having this soothing treatment. The scar itself is a connective tissue repair, so it's not like for like. The way that the collagen is laid down in scar tissue is crosshatch rather than basket weave, so it tends to be less good at dispersing movements in all directions. It can often develop sticking, so adhesions from one layer to the other. We've definitely got that going on here with Andy, because when he stands up, we've got quite a strong sort of puckering in. I hope you're enjoying this video. Don't forget to come over to my website and follow me on Facebook and Instagram for more information about working with scars. Let's carry on with that demonstration. And internally, we've got to remember, even though we can see the external scars, that there's internal scar tissue where the surgeons will have been moving the devices once they were internal in order to do the surgery.
The middle scar isn't as sensitive to that. I don't feel it as much. It feels number.
Yeah. And up here?
It's reasonably numb as well, I'd say. So the bottom scar is more sensitive to it. It's all very pleasant, but bottom
You
scar
can
is
feel more.
more, yeah.
Now with the deep oscillation, you can't use it if the skin's really damp or really moist. If the client was more sticky, I would be using a powder in order to dry the skin, or you can use it with an oil, but you can't use it with water because it interferes with the electronic pulsing. So at the minute, I'm not getting any concerning skin drags. I'm quite happy to work without adding additional drying onto the tissue. It doesn't feel like it's causing any irritation on application. Is that right? It's not dragging on your skin or irritating your skin. And now just coming up to work on this scar here, we can see that there's a little bit of kind of puckering as I put a bit of pressure coming in this direction. It's kind of wanting to fold once I push the skin down a little bit. So I just want to make sure again that I'm tucking up underneath that. And again, just coming with different angles. So I'm just a little bit more weight in my fingers now, just to kind of scoop in underneath it. And again, I'm trying to stretch that, trying to take it in different directions. Is that more sensitive now I'm doing that, or is that still okay?
It's absolutely fine. Is it more sensitive than it was? It's possibly a little bit more conscious of it, yes.
And I can feel, as you use the device, you can get more clarity of the textures underneath the tissue as you get clearance through the interstitial tissue, through the connective tissue. This is a very hydrating technique, so the deep oscillation lifts and drops the tissue. I essentially stick onto the body and it lifts and drops the tissue, and so what it's doing is opening up those pathways, helping to soften fibrosis. It's very soothing on the nervous system, so clients normally report this as being very pleasant, very relieving, and it's absolutely fantastic for patients that I work with who've got chronic regional pain syndrome, so CRPS. It really can be a total game changer for those individuals to help with their pain, and they feel a massive sense of relief with this treatment. So I get it out a lot when I've got clients who've had a lot of discomfort, and particularly I would use it towards the middle or the end of my treatments, so that I do some more dynamic work, really get the tissue stretching and moving, and then after that I get this out as a kind of soothing and calming treatment to deliver at the end. So that's not a hard pressure that I was doing there. I'm just getting all of this moving, having an intention to send some of the deep oscillation in under those tissues. So had this setting on, it's an individual program here. I've had it on for 9 minutes now. It's going to do 1 more minute and then it's going to move into a much slower oscillation, which I feel tends to hit the deeper tissue. Before I move on to that deeper setting, just going to go a bit more broad, a bit more wide, connect up through before we change. Very good for the digestion as well, this. So if you hear tummy noises with your client, that wouldn't be surprising. It helps with constipation. I hope you're enjoying this demonstration. Have you checked out my Facebook and Instagram pages yet? It's coming up on the screen. And it's just moved on to that next setting down. So the vibrations got slower. Now on to 60 Hertz on a 2:1 ratio. How does this feel, Andy? How would you describe this?
Wow.
Is it?
Spot.
Did you prefer the first one? They're both pleasant but in different ways?
They're both pleasant in different ways. The first one just feels like lovely, soothing, stroking feeling. This one feels pleasant, but obviously more doing more.
Feels more powerful.
More powerful, yeah.
Yeah.
More of a push there.
And Andy describes it as a push, but actually it's a stronger lift.
Okay.
Which is not a problem at all. It's helpful that you use that word because a lot of my clients might have this and then look at vibrational machines and sort of say, oh, can I get this massage gun? But actually what's really lovely about this, if we think about what's going on in the scar, is everything's kind of matted and compressed. And what's really lovely about the deep oscillation is it's actually separating the tissue slightly with its lift action, because it's almost as if as I move across the skin, the layers are being pulled up towards me rather than me pushing down. And so therefore it's, for me, a good reason why this is significantly different than just a vibrational device that pushes down on the tissue, which obviously could potentially be compressing slightly over tissues that are already kind of matted together. So I always say just use deeper techniques with caution, because that could actually be adding additional compressive force on tissue which is already kind of matted and stuck, and we actually want to lift up, separate up, and get that moving.
It reminds me a bit of a TENS machine.
Yeah. When did you use the TENS machine? Like with pain?
I used it on my back. I used it the night after the operation because my back was in absolute agony because of the position I'd been stuck in for hours. So. But I've used TENS machines. We have a cheap one that I used to use past tense because my back was a mess. Touch wood, it's been really good for some time now.
Oh, that's great to hear. Coming back, just repeating through some of those techniques, but now with the deep oscillation going on. So just kind of stretching that, getting in under there, so stretching it so it just starts to fold a little bit. It's got a little bit of stretch on that deeper tissue, and then just coming in with my outside hand here and just sending those waves in underneath there. Coming from different angles. Really getting up under that tissue, and I'm interested in the positions that the tissue moves in where it really presents where the stitch marks are, so where you can really see the little divots that appear either side of that smaller scar. And if I come parallel to the scar, they're less obvious unless I'm more superficial. When I come from this angle, we can really actually see them when I'm a little bit deeper. So you had stitches in the upper scar and glue on the bottom one?
Yes.
Or staples?
No, there was glue and stitches in the bottom scar.
Ah.
Not particularly elegantly done, I didn't think. And near my belly button there was a real mess. It was quite a... And the outer scar was quite raised, and I think the glue didn't help because it kind of glued everything into a ridge, if that makes sense. Yeah, because it was a hard substance, it didn't move.
Again, I'm just coming in, trying to get underneath this lower scar. We're very aware that there's different layers of tissue that have been sutured. So we've got sutures through the muscle, and what we want to try and increase for Andy is the space when he's doing certain movements, because the upper tissues are attached down onto that deeper fascia, that deeper muscle there. It's causing pulling, prickling, it will be affecting digestion, so lots of things like that, kind of because you've got a bit more irritation there. So I'm just trying to use these techniques just to lift, separate, while still being soothing. So now I'm just coming in, just lifting that tissue, working along there. Is that prickly at all, Andy?
No, it's fine.
Okay.
It's okay.
A little bit of pressure on there.
I'm presuming my posture, because I am hunching over it, but
yeah,
I'm not really getting properly upright.
And then just follow that off after that more intense technique, just a little bit of easing away from the area. Let me see if I could show that more clearly, but I don't think I can. Maybe I can catch it on this one.
I think it's actually my posture, and I notice it most, that it's pulling. I don't subconsciously. I have to consciously think about standing up properly straight.
Again, just making sure we go wide with this, that we're not just treating the scar that we see on the skin. This will be having an effect through the connective tissue, throughout the abdominal, going across those fascial cross lines, through that deeper fascia, through the pelvic floor. All of those tissues will be affected, so just making sure that you're not limiting yourself to being too narrow. You can almost see these little waves appearing on the skin for how the oscillation is working through those tissues. And again, just thinking about my angles to make sure that I'm coming in across this at all kinds of angles. If you think about it like a sonic wave kind of coming out, it disperses as it comes away from your glove. So you really want to make sure that you capture different angles with your treatment application. You're not always just pointing in one direction. For the therapist, this feels really gentle. I can feel a contact, I can feel a sticking, and just going on to a really higher resolution now, well, 150 to 180, but with a 1 to 3, so a much faster drop, just to really kind of bring that back up to the surface to finish off for a few minutes here. So it feels lighter to me. I should imagine it feels lighter to Andy.
Yeah, it's almost negligible.
Yeah, really nice. Just you can hear a slightly higher pitch of the buzz there. And again, I think this is more superficial, more calming on those superficial layers. So a couple of minutes here just to finish off, because Andy was reporting that there was some tenderness or sort of nervy type feelings after the last treatment, where I was doing a different kind of demonstration. So I didn't use deep oscillation last time we had Andy in. We were doing some silicone cupping, which is one of the things I teach on the course. So it's really important for, if you're going to work with scars, to have a really good toolkit of different techniques, because you need to respond to what the client needs, what they want, where they are at their stage in healing, and what their symptoms are. And certainly deep oscillation is something I get out a lot where there's been keyhole surgery, so you can't always see what's going on the inside. It's very, whereas obviously with an open surgery is more obvious thickened fibrosis, which we get here, but it's harder to feel around these smaller scars. Also, it's very helpful clients in a lot of discomfort in early healing where there's a lot of swelling or lymphedema, because it's increasing lymphatic flow, opening up through those lymphatic pathways, so very good. And it can also be, it's so safe, the deep oscillation, it can be used for patient self-care. So I have a few patients who've bought one for their own use as well, and they've been absolutely delighted with it. So definitely something I wouldn't be without in my clinic. So I'm just going to turn that off now, take off the little dumbbell. So this is what the client can either hold that, or I put it in between his toes. Doesn't matter where on the body. They just have to have contact with the metal bit. It doesn't matter if they're wearing rings. It doesn't matter if it's over metalwork or anything like that. And then I will detach the little attachment for myself. So that looks like this. I have a little sticker which goes on to me. They clip together. You can have it on your hand, but I much prefer to have it down on my leg. It's totally out of the way, really easy to use, just clips on, clips off. So with anything, you want to have a look at the end, see how the tissue's moving. That feels less bulky in there to me. Feels a little bit softer, a little bit more flushed through, a little bit nice and plump, and similarly around here. Got a really good picture of what's going on underneath. I can really feel clearly those deeper tissues, so it's kind of softened off some of that thickened fibrosis. I was lifting the tissue up to begin with, and I was doing a little kind of sliding just to see where we've got pulling and shortening, kind of what does it feel like at the end of the movement. How's that feeling to you, Andy? Do you want to have a little feel?
Yeah, if I can find it. Yeah.
So where's your little P that you said
P
you were always
there.
planning? Yeah. Can you feel it more clearly now, or does it feel the same, or does it feel anything?
It feels slightly less, I would say.
A little bit softer.
Yeah, no, it feels a little bit softer, a little bit smaller, flatter.
Good.
So, and without touching it, it all just has faded away a lot from before you started. I was more aware of the whole thing. Now it's much less aware of it.
So even though we were doing some quite strong little stretches before we started the deep oscillation's really kind of let it all calm down and kind of left you feeling a little bit easier. That's good.
Yeah, definitely.
Thank you very much. So that brings us to the end of this demonstration on using the deep oscillation device. I hope you found this really informative, and don't forget to subscribe to my YouTube channel and check me out on Facebook and Instagram, LinkedIn and Twitter to find out more.